side that we're going to be testing, you can fixate the leg here to make sure that they're.
It doesn't.
So.
It doesn't. It just doesn't.
But what you'll end up seeing with this is we're trying to get, could you bring your foot in this way for me? So what sometimes you see is you see motion come all the way up through. So you want to make sure that you're stabilizing here. To isolate rear foot inversion and eversion, there's no cue for that. Could you please bring your calcaneus medially, please? No. See? So again, you would bring with inversion the same way. So go ahead and relax. So bring your foot in, and now bring your foot out for me, please. So again, kind of screening the motion. You can see here there's not a whole, just on visual assessment, he's getting more rotation. So go ahead and relax. I'm also identifying the point in which I saw the movement occurring around. Is again, it's documented that you're between medial and lateral malleolus, but that encompasses somewhere between there. So using that screening can help you better identify where your fulcrum is going to be. So at about that point, this is going to be in midline with the leg. You're again just looking for a parallel course with it, making sure that you're bisecting the leg. And then the 0 from that point comes directly through the calcaneus. So Mike, could you bring your foot in for me? And again, just focus on the calcaneus here. So double checking and realigning the fulcrum here. And he's at about 10 degrees there. Go ahead and relax. And be careful when you're doing passive, so you're assessing the 0. Make sure that you're just moving the calcaneus. And there I start to feel restriction. Because if I get too much subtalar, talar curl, you're going to end up like that. But that motion is coming from elsewhere. That's not coming through the calcaneus here. And the same thing, could you bring your foot out this way for me? Not much. About 4. And go ahead and relax. And a little bit more than that, 5 or 6. So just a couple degrees more, but again, more restriction that way, which makes sense because again, on heel strike, we're going to land on that more lateral aspect. So that's going to bias this motion a little bit more as opposed to going into that everted position. Questions with that? Could I have you on your back, please? So for the great toe, you can use different goniometers for this one. What you're using for a point of reference here is, again, you're using the first MTP joint is going to be where your fulcrum is located. Palpate along the first ray, and that's going to be your proximal arm. And then he's already a slight amount of extension, so you want to make sure that he's able to get to 0, which he's able to. And be careful that you're not measuring the IP, because a lot of people, when they go to flex MTP, will also have associated IP flexion. So could you please bend this toe down as far as you can go? Bend this toe. Can you curl your toes?
Oh, yeah.
Not much. And yeah, he's getting to passively go. Getting about 10 degrees there. I'm making sure I'm on the phalanx still. So yeah, that's pretty restricted. You can see though, just in resting, he's already in that slightly extended position. So this is the important part of making sure that they can get to neutral. So he can, but actively, and that might be extensor tendon restriction, that might be capsular restriction here, but then my manual assessment would take me to go start to assess glides of the MTP joint to see what is causing the restriction. And then for extension, again, you can do some passive motion, so then if you're like worried about where the fulcrum is going to be, is just find out where that pivot point is. Now can you go ahead and bring your toe up for me? So yeah, he's got quite a bit. So he has close to 80 degrees of extension.
Very nice.
Well done. Actively.
Yeah.
And then you can apply the, yeah, he'll probably get to close to 90
Done.
with overpressure. And making sure that you're palpating underneath there, make sure you're on that first ray. And there you go. Well done.